This video is going to cover the details of imaging the shoulder. So first we have a series of drawings showing the anterior, posterior, and medial views of the scapula. So you can appreciate the coracoid process, the spine of the scapula, as well as the acromion. And then in this medial view, you can see the glenoid cavity. And so one thing I wanted to point out on this medial view that we'll be able to appreciate on a lateral radiographic view is that the acromion and the coracoid process make this sort of Y shape along with the body of the scapula. And so the lateral view is what we call the Y view of the shoulder. So here we have two views of the right and left shoulder. You can see the right view over here, left view over here. And again, you can note the Y-shaped structure formed by the acromion and the coracoid process on each side, and then you'll note the way that the humeral head usually sits right approximately within the Y of the scapula. So if it's located outside of that Y, that usually is indicative of a scapular or of a glenohumeral dislocation. So here we have another Y view image where it actually, the dotted line shows you the Y of the scapula with the acromion and the coracoid process, and then you can make out the white dotted line here is showing you the head of the humerus. So remember that the glenoid cavity or fossa is made deeper by a fibrocartilaginous ring, which is called the labrum, the glenoid labrum, and so that can also be injured. So we'll look later on at some MRI images, which is the most notable way to assess the labrum, although we're not going to be looking at any pathology, but just realize that is a structure that is considered on radiographic imaging. Here we have another drawing of the glenohumeral joint components. So we can see obviously the head of the humerus with the anatomical neck, and then you can appreciate the lesser and greater tubercles or tuberosities respectively in this image, as well as the surgical neck of the humerus. And then down here you can see the shaft of the humerus. So remember that the surgical neck is going to be the most common location of proximal humeral fractures. So here we have a view of the right shoulder where the shoulder is in an externally rotated position. And you'll note if there's a tangential line drawn along the greater tuberosity or the greater tubercle of the humerus, you'll note that it's not in line with the acromion process over here. So it remains lateral to the acromion process. So realize that that's not an abnormal view. That simply means that the shoulder or the arm is externally rotated in this view. And then in the next view, you can see here where now it's been internally rotated, and now that greater tuberosity is going to be in line or underneath the acromion process. And so again, neither one of these is indicative of any sort of injury or pathological state. It's just simply showing an external versus internally rotated shoulder. Now in this case though, you'll note that you can see the glenoid fossa or the glenoid cavity, but the humeral head is not aligned with the glenoid cavity. And so this is indicative of an anterior shoulder dislocation. This is by far the most common type of shoulder dislocation, and it typically results when the arm is forcefully abducted, externally rotated, and extended. And in this case, what happens is the humeral head is going to be located anterior, medial, and somewhat inferior to the glenoid cavity. So that's exactly what this image here is showing, is that it's, again, lying in an anterior, medial, inferior position. So here we have a lateral view now, and remember how we said with the Y view, normally you're going to see the humeral head located somewhere within that Y structure, but here you'll notice that the humeral head is clearly located in an inferior, medial, and more anterior location relative to where it normally would be sitting within the glenoid cavity. And so this is another anterior dislocation of the shoulder. And then in this view over here, you can see where the humeral head has been, or the glenohumeral joint has been replaced, reset. And so that's the view that you'd expect to typically see. So that, again, that indicates that the clinician was successful in getting the humerus back in to the glenoid cavity. And then just a note here on complications of shoulder dislocations. One thing that can result is you can have a fracture of the greater tuberosity or greater tubercle of the humerus with shoulder dislocations. So here you can see a small fragment of the humerus in this individual. And then over here, this is what's called a Hill-Sachs deformity. So notice there's kind of this little indentation here of the proximal humerus. And so this is indicative of chronic shoulder dislocation. You get this Hill-Sachs deformity. And then this is an example of a scapular fracture. So you can actually see a couple of different scapular fractures, which are pointed out by the black arrows in this case. But in any event, that's another thing that you want to be evaluating when you're looking at the upper extremities. So when you're looking at the shoulder, in addition to evaluating the clavicle, the acromion process, the proximal humerus, coracoid process, you also want to be looking at the body of the scapula. And in this case, you can see evidence of at least on this one, you can see a very clear fracture. There's another fracture up here as well. And so now we're going to look at some MRI and ultrasound images of the shoulder. So these are common techniques that are used to assess the soft tissues related to the shoulder. And so hopefully everyone remembers the rotator cuff is this sort of tendinous reinforcement, or provides tendinous reinforcement or stability to the shoulder joint. So this is really important because of the fact that the humerus does not sit deep within the glenoid cavity, and so you really need the tendons of the rotator cuff muscles to reinforce the shoulder joint. So some of the muscles that contribute to it, remember, it's the sits muscles. So you can see the supraspinatus here as one of the muscles. The subscapularis is going to be another one, as is the infraspinatus and the teres minor. And so in this case, this is a normal supraspinatus up here, where you can see it traveling underneath the acromion process and eventually inserting onto the greater tubercle of the humerus. And the image on the right-hand side here, we can see a tear. This is a full thickness tear in the supraspinatus muscle with retraction of the muscle. So that's why you see this kind of bulge right here, where the muscle is actually retracted from its point of insertion on the humerus. Another thing that you can note in this image as well is there's a clear view of the deltoid here. So this is a coronal view, coronal section through the shoulder, where we can appreciate the supraspinatus. And that's the most common site or muscle that's affected in a rotator cuff tear. Though the other muscles can certainly be involved, supraspinatus is just the most common. Here's another view of the rotator cuff. So this is another MRI. This is a T2 weighted image with fat is slightly attenuated in this view, and so you can appreciate this hyperintensity indicated by the arrow, and that's another indication of in this case, a partial tear of the rotator cuff. And so here you see, and this is once again the supraspinatus. So here you can see the supraspinatus. So again, usually right underneath where it's passing underneath the acromion, that's the most common site of a tear affecting the supraspinatus. Here you can also see infraspinatus and teres minor. Remember, subscapularis is going to be located anteriorly. Now we have some ultrasound images that are showing some of the structures of the rotator cuff as well as surrounding structures. So you can see the trapezius along the outer margins here, where deep to trapezius you can see the supraspinatus. The black, the hypoechoic region, that's going to be the spine of the scapula. So then right below that you can easily appreciate the infraspinatus. And then here you can see the differentiation between that and the teres minor muscle below, and you can also see part of the trapezius up here as well. Here we have another view of a couple of different supraspinatus tears. So this would be a rotator cuff tear as imaged by ultrasound. And so here's an example of one tear in the left-hand image, and then this is in a different patient, but this is another tear of the supraspinatus tendon in this individual. And then this is a third example of a supraspinatus tendon tear. So you can see the greater tubercle where it's inserting. And in this case, you can see where this whole region right here is where the tendon normally would have been, but now you can see where it's retracted all the way back to this location out here, more proximal, so closer to the main belly of the muscle. And then finally, we have a view of the subscapularis tendon here. This is a normal view of it. This is not torn. But you can see just a good example of each one of these arrows representing the individual tendons of the or tendon bundles of the subscapularis, and then in between these kind of hypoechoic regions are going to be the intervening muscle fascicles. So you can see the muscle fascicles next to the individual tendon bundles.